Welcome back to Canadian Justice, where we're discussing a new free book that you can obtain online at the ccf.ca/free healthcare book. You can claim your free copy online. I want to talk a little bit more about this chapter of the book that you've written, Colin, on preventative healthcare. Now, Shawn, you're a physician. What is your take on the role of prevention in healthcare and how it could actually improve our system?
So I'm going to separate that to say that prevention is absolutely important. You can exercise, for example, will reduce your rate of 13 different kinds of cancer. So that's just cancer and exercise. How do you make that connection? But statistically, it works. And so I would argue that the case for prevention is actually a moral case. So if you see someone living in a house with the roof on fire, you run in and say, "Hey, your roof's on fire. Get out of there. You know, you're gonna get burned." And that's kind of the same approach with prevention. I worry though about saying that we can prevent our way to health savings. I agree with Colin. Perhaps we could get a shift in allocation and perhaps use our resources a bit more efficiently. But there is solid research that suggests that if you save a person from harming their health and you get them to live another 40 years, the overall economic impact is actually negative. So it actually costs more to keep people alive for 40 years as opposed to being heartless and cruel and letting them die young. So I think the case is a moral one. It's the right thing to do. We need to keep people healthy, but I would be cautious about banking it all on economics.
Colin, what's your reaction to that?
Well, I would agree with what Sean's saying that there certainly is a moral case. I don't look at this as a way to save money in healthcare, but rather to have the resources freed up to help people who don't really have a choice. You know, the sad thing with cancer is that quite often you could be as healthy as you want, exercise, have a great diet, but because of a bad luck of the draw with your genes or whatever, you may have a genetic form of cancer. And it would be great if the healthcare resources were more focused on people in that type of a situation rather than people that maybe could have avoided, having a disease like that, diabetes, other health problems. So that's really what we're thinking about is not a dollar savings overall for governments, but just allowing the resources to focus more on patients
Now,
that
Colin, one of the
choice.
things that you talk about in your chapter is these small financial incentives that can lead people to make healthier choices, like exercising more, eating healthier, quitting smoking. And you say that there are examples in other countries of policies where there are these types of small financial incentives for lifestyle changes. Can you give me some of those examples?
Yeah, so some of your viewers may know, Christine, that there's a grocery store chain called Safeway. It's in different parts of Canada. It's an American grocery store chain. And in the US in the past, their former CEO wrote about how they introduced some financial incentives for the health insurance plan for the employees at Safeway. And what they found was that by introducing some small incentives, it could lead to some patients changing their behavior. So if they could save money on the premiums they were paying for healthcare if they didn't smoke, or if they had lower cholesterol rates, if their body mass index was lower, et cetera, et cetera. If they lived healthier lives, then they would save some money. And what they actually found was that it did change behavior. So we talk in the chapter, and we've talked as an organization about how you have to be very careful with this topic because you don't want the government intruding in people's lives. But we certainly think that it's important for governments to experiment at least with different ways to maybe encourage people to, um, you know, engage in some more healthy activities so there would be less strain on the healthcare system.
So, Dr. Whatley, we've only got about a minute left, but I'd be interested in your take on these types of financial incentives and how they might work.
Well, it brings up the topic of horizontal equity, right? Is it fair that you and I pay exactly the same amount for our health care when I don't use it very cautiously at all? I go to the doctor over and over and I don't take care of myself and I ask for repeat x-rays of my knee and then I end up getting my knee replaced at the same time as you, or maybe I should say Colin, let's pretend we're identical twins. And so that's the concept of horizontal equity. And when you start talking about these small incentives, you start touching on this issue that if we have a shared resource, we should all work together equally hard to protect it.
Really fascinating. We've got to go to commercial break now, but when we come back, I want to talk about the role of the courts and that they could play in addressing patient choice. This is an issue that I have worked on, and I have a chapter in this book about, so I'd be interested to know both of your perspectives on that. We will be right back.